The United States has seen a recent uptick in sexually transmitted diseases and infections recently. 12 News' Kate Cornell is live here in our studio to tell us where we as a state stand. Kate?
Jade, Mississippi is high up in the ranks across the board for STDs in the United States. Staff at My Brother's Keeper and Open Arms Healthcare in Ridgeland told me how we can work to find a solution.
Mississippi.
#1 for gonorrhea. I know.
In addition, Mississippi ranks #3 for primary and secondary syphilis, as well as #3 for chlamydia, according to staff at My Brother's Keeper and Open Arms Healthcare Center in Ridgeland. Deja Abdul-Haq is the director of organizational development. She says one of the main contributing factors is lack of sexual health education in our schools.
Dusty curriculums at best.
She says the practices that our schools are using are mostly ineffective scare tactics, rather than concrete evidence.
In schools, they are promoting abstinence in the best way that they know how. And everything outside of abstinence is taught as a scare tactic. No science, no data, no prevention methods. There's a level of detail that's involved in explaining to people what sex is, what sexually transmitted infections are, and how to prevent them.
Abdul-Haq says we have a duty as members of a community to regularly get tested. She understands that testing isn't always economical, but she is able to provide a solution.
At Open Arms Healthcare, we provide a free screening called a Becoming a Healthier You screening. It's a BHU for short. You come in, you ask for a BHU. Not only do you get an HIV, chlamydia, gonorrhea, and syphilis screening, they also include glucose, cholesterol, BMI, Hep C, and Hep B at no charge.
She says that one of the most impactful things that we can do to decrease the climbing rates is easy.
Stop stigmatizing sex and sexually transmitted diseases.
Abdul-Haq reminds us that receiving a diagnosis is not a death sentence. It is treatable and curable if you act quickly. Melanie and Jade.
Thank you very much, Kate.